Hi, it's Dr. Lisa Koche here at Spectra Wellness in Tampa, Florida, where we ignite the full power of your mind and body. So glad to have the Adapt Your Life team and be a part of them. Looking forward to my event coming up on February 23rd here in Tampa. Hope everyone can attend. Dr. Ryan Lowry speaking, and I'm going to be sharing a lot of my experiences with the ketogenic diet, and we really hope to see you there. So just wanted to give a quick video to talk about how I became really excited and intrigued with the benefits of being in a state of ketosis. About 5 years ago, I was doing a lot of research on cardiomyopathy as I have had a significant personal journey. Started at age 15 with leukemia, had 5 years of chemo, which unfortunately caused pretty severe cardiotoxicity. I was able to rebound at that age. I was taking CoQ10 and carnitine, had no clue what those substances were. My uncle, who was a podiatrist at the time, just sent them in the mail. I was really lucky on that regard and was able to get my ejection fraction back up to about 50 to 55. Normal, if you know about cardiac echocardiograms, is about 60 to 65, not 100, but I was still what was considered low normal, was able to run, competed in a 15K, was even able to get pregnant, and with each of my kids, the ejection fraction took a little bit of a hit. Delivery was a problem. So by the time I had my son, who's now 7, I was having some significant symptoms where I couldn't push myself and run. So my dreams of being a little bit more competitive athletically were put on hold, but I was able to run my practice, which is a very busy, awesome, comprehensive functional medicine practice, and was constantly researching what the best diet would be, not just for me, since I didn't really need it for weight loss, but also for my patients. So I spent about 15 years in clinical practice looking at things like hormones, adrenals, thyroid, the gut, healing leaky gut, finding I felt a ton better as I healed myself, doing a lot of work on detoxification. But again, the missing piece was the ability to really have more optimal performance, the ability to be able to run and push myself and have phenomenal energy and reserve. Those things were definitely not present after my second kid. So I came upon a podcast, was very lucky to listen, Dr. Mercola and Dr. Dom D'Agostino, talking about the benefits of being in ketosis, which I frankly had never really heard about in any detail. And as they were talking, they mentioned that being in a state of nutritional ketosis triggers mitochondrial biogenesis. So what those fancy words are basically is the fact that we have something called mitochondria in all of our cells, just about all of them, not your red cells, but every other one. And in that organelle is how we make ATP, or energy production, that all of our body needs to do its daily functions, even the heart to beat, our brains to think, our guts to digest our food. So if our mitochondria are not working well, we are definitely not going to feel optimal. You may have learned about mitochondrial function in high school. For me, that was honestly, they talk about it in high school biology. They talk about it in med school a little bit, but it was really never focused on, especially when we were talking about how to deal with a patient on a day-to-day basis. I had already gone out of the box, really researching functional medicine, knowing that there was more than what met the eye with standard blood tests and scans. I brought in a naturopath who practices kinesiology, which was an incredible addition to my practice. We were doing some really cutting-edge structural work with a chiropractor as well, but the patients were still not getting as far as I wanted them to get, including the number one patient, which is always me. So I have been through my life the most complicated case, and as I've learned on my own body, I've been able to share it with my patients on that journey. So during this talk, when he mentioned mitochondrial biogenesis basically means new mitochondria. It's very well known that chemotherapy especially, but many other things can damage your mitochondria. So about the past 5 years, there's been a big shift in focus on people with chronic fatigue and people who are not responding even to functional medicine therapies to take a look at how the mitochondria is functioning. So when I heard not only could we improve the function of the mitochondria, but we could also make new ones, I was all over that because I knew I needed more mitochondria. Symptoms such as brain fog, fatigue, the inability to run, multitude of other issues, including low hormone states and low thyroid, actually rely on mitochondrial function. As I listened more, I realized that Dr. D'Agostino said something about his research at the University of South Florida. That's when I almost dropped my phone that I was listening to the YouTube video on, because I am 15 minutes from the University of South Florida. So picked up the phone, gave Dr. D'Agostino a call, and he and I collaborated, was able to go out and check out his lab, and started really becoming intrigued with the ketogenic diet. So most of this audience understands what being in a state of nutritional ketosis is, and utilizing fat as the primary fuel instead of carbohydrates. At that time, again, which was about 6-7 years ago, I started watching patients very closely because there wasn't a lot of information online about how to do a ketogenic diet correctly. And we had a 12-week program, and what I was finding is that many of my patients would do well for about 6 weeks, and then they would get in trouble. They'd start getting more tired, or they'd pop out of ketosis. They found the diet very tough to stick to. So I kept researching, branching out, and trying to find other options and ways to help on this journey.